What up? And marry these two things. You become one. Stupid. Is this right? Hey guys, William here, fitnessforbackpain.com. Thank you so much for tuning in. Today we're talking about abdominal bracing and breathing, and taking these two things that 90% of people do wrong, who have chronic lower back pain, who fail when it comes to getting relief from doctors, medication, chiropractors, whatever. I'm gonna teach you how to take these two very dynamic contributors, marry them, so you can start seeing relief. So check this out, guys. Short video. Apply, apply, apply. See you in there.
All right, so let's take the big picture. And in this case, we're talking about bracing and breathing and applying that to everything. Okay, so you've got how to find neutral, you've got how to stack, you've got all these different tools that you can use to find neutral, to desensitize your lower back, to put yourself in a position where you just feel good, where you feel like you're in a stable place. Now from here, you have to teach your body how to stabilize and to brace what is right. Okay, so what is right for you and me is finding what neutral is, and then building strength and endurance on top of what that neutral is, okay? So we've gone through all the positions on how to find neutral. Once you have found neutral, assuming you've stacked, assuming your pelvis is in neutral position, what I want you to do is take your hands like this and push them right above that hip bone, both sides, and you're gonna squeeze in, okay? So from here, what I'm gonna do is I'm gonna brace as if someone's gonna hit you in your stomach, push in, and I want you to brace out. So prepare your stomach for that punch. Relax, brace, relax, brace, relax, brace. So from here, what I want you to do is do what's called raking. Take your fingers and you're going to pull and push and move around the different parts of your trunk. Go all the way to your lower back. Is it contracted? Is it tight? What about your obliques? How do those feel? Move around. It's pretty tight. So from here, so I've braced, I'm still bracing. My breathing is kind of shaky, or my speech is kind of shaky, because basically I'm trying to breathe and brace at the same time, and it just takes work, and it takes time to learn. So once you have the brace, what I want you to do is introduce the breathing, okay? What is natural to feel when it comes, if you're naturally a chest breather, what's gonna happen is you're blocking your chest and you're going straight to your belly. Or diaphragmatic breathing. You're breathing into your belly, breathing into your guts. That's how you should be breathing. So when you apply it, so if I wasn't bracing, this is what it looks like to breathe into my belly. So I'm not just filling my belly and my stomach and pushing my stomach out. I'm not doing that. I want to fill my whole lower trunk with air into my butt, into my groin, into everything deep, deep down in there. I want to fill with air. So it's going to press out. It's going to press against my sides. It's going to press against my stomach. It's going to press down into my groin. It's going to press out into my lower back or my lumbar muscles, my erectors. I should feel everything kind of expand. That's what you want to think when you're breathing into your belly. Don't just breathe into your literal belly and poke it out and anterior toe tilt. I want you to create space in your entire lower trunk. So here, exhale. Allow your lower back to relax. Feel that area. Allow your groin. That's the deep belly breathing I'm talking about. So now we're gonna marry the brace and the breathing together. Take your hands above your pelvic bone, push in, brace. You can do it a couple times if you want, but brace. And now what I'm gonna do is do that exact same breathing deep into my belly, deep into my guts, into my groin, while I'm bracing. So your breathing may be labored. It may not feel like you can do it. You may have a little bit of chest pains because you're so used to breathing up here. Now you're bracing and trying to force air down into your trunk, creating this piston type effect that it's just stretching a lot of stuff out that you're just not used to doing. You're not used to using your lungs and your diaphragm and your core at the same time the right way. So it's gonna be very weird. It's not gonna be natural. It's gonna be hard. You're gonna keep doing it until it gets better. And you will get better, I promise you. So brace again, breathe down deep. Everything is still super tight. So as you're breathing, poke yourself, rake yourself, push into areas where you're like, oh, this feels kind of soft. Brace and keep pushing, keep pushing. Breathe into that area. And you pushing is forcing your brain, and anywhere you touch, you're forcing your brain to make a connection with that area. So if I'm bracing it, I'm breathing, but this is still very soft, touch it and allow my brain to think, okay, contract that corner, contract that oblique, contract this, contract this, contract this, and then breathe. So you're marrying all those things, the bracing, the breathing, around what should be neutral. That is the big picture, okay? So once you've learned how to do the neutral positioning, then practice the bracing and breathing. You can do the bracing and breathing anywhere, on your back, kneeling, on all fours, sitting, standing in the shower, using the bathroom, talking on the phone, sitting down at the desk. No matter where you are, practice the bracing and breathing. It's a staple. You have to be able to do it. If you can't do it, if it's hard, you can't skip over it, okay? You want to get better, do it right, okay? So practice this. If you like what you see here, make sure you hit subscribe. If you want to see more, shoot me a comment. What do you want to see? I'll make it for you. Thank you so much, guys, for watching. This is William, fitnessforbackpain.com, reminding you to think before you move.